Traveling to Panama changed my perspective of life. It has opened my eyes and made me more culturally aware of how people in other parts of the world live. I became accustomed to a lifestyle where I was jaded to poverty among all economic classes and needs that people who are less fortunate might experience. Even though we spend a lot of time learning to cope with such a big communication barrier, we as a group of nurses banded together through determination to make a change that could impact the vulnerable population. Nurses in Panama hold the highest standard of care. They provide good principles of ethics and advocate for their patients in order to deliver the best care possible to each individual, regardless of their socioeconomic status or educational level.
Our trip to Panama consisted of many activities to provide help and care to those in need. Some of the more memorable moments were when we participated in health fairs and home visits with the students from the University of Panama. The home visits impacted me because while we were traveling and assessing, we were treated like family and were able to experience what it was really like to be Panamanian. Seeing how a different culture lives and functions individually and as a community will benefit my quality of care as a nurse. Being a nurse in Panama means to provide care no matter the cost. If a patient needs something they don't have, the nurses and community come together to buy or get it for them, whether it's a mattress or formula for a child. Nursing truly knows no bounds.
I feel that this trip to Panama has helped me grow personally and as a future nurse. Since I came home, I am so much more thankful for everything that I have in my life. In my professional career, I feel fortunate to have experienced such an opportunity that I can learn and grow from. I feel that if it left me with a desire to participate in activities like these, where I can use my professional services to help less fortunate people who will truly benefit from it. Working with American and Panamanian nurses has given me hope that so many people are willing to make a change in the world, even if it's not seen right away, but through our perseverance, all the good deeds we do will one day show.
Health disparities exist among the rural and indigenous populations. The majority of specialists and hospitals are located in Panama City. For cases that require advanced treatment and specialized care, the medical system fails those living in rural areas. During my clinical hours, I noticed that malnutrition and diseases indicative of extreme poverty were not widespread in the community. Most children had updated records of vaccinations and came to the clinic with growth charts provided by the government. This was reassuring to find that the government invests in public health and primary care for its citizens. Although I didn't see homeless in the streets of Chitre, I was well aware that there was indeed poverty. An example of this was the case where some students from my clinical group visited with a baby whose grandmother had no knowledge of how to care for him. The baby slept in a hammock and underneath it was mud and gravel. Their home could hardly be considered a house. Sally Beth, a Panamanian nurse, suggested taking baby items to the hospital where the baby was receiving care. I asked my instructor if we could all participate, and it was then that I realized what it felt like to give back. My classmates and I went to the store and purchased formula, diapers, clothes, and toys for the baby and presented them to the grandmother. It was an amazing experience that I'll never forget.
When traveling to a different location, being culturally aware can refine your visit beyond compare. Even though other countries define nursing with a variety of skills that may differ from our own, an objective of providing quality care for those in need stands as a bridge between us. By embracing cultures from other countries and advocating for what they, as a united people, cherish, a nurse can begin to immerse themselves far beyond a standard level of care. They become one of the people in order to effectively advocate with their greatest interests in mind.
These 2 weeks abroad shaped me to become a more culturally competent nurse because I was placed outside of my own comfort zone, thus requiring me to adapt more, ask for help more, and be open to people I've never met. I honestly did not know what to expect, but I tried my best to mentally prepare for what was to come. I remained open-minded and non-judgmental During my trip, I didn't realize how quickly I was able to adjust to the culture and customs of this beautiful country. This experience has allowed me to demonstrate my culturally sensitive attitude. I will continue to carry this quality throughout my nursing career and be sensitive to those I care for in the future.
To be a nurse in Panama is to advocate to and for the people at all times. Much like here in the US, nursing is an encompassing profession that thrives on public interactions and care across the whole life spectrum. Nursing as a whole in Panama embodies the ideals and values of public health nursing in America. Adapting my behaviors so they are centered around public health instead of traditional medical surgical approach was my first priority. To better the community for present and future generations, we focused our efforts around prevention and education. By addressing prevention as an urgent need, we can cut down rising costs of healthcare in addition to enriching people's lives with knowledge they can use to possibly have a healthier and more beneficial life.
While in Panama, I learned a very important lesson. Even though nurses or healthcare providers don't have the same height and equipment we are used to in the US, they still provide quality of nursing care that rivals ours. Panamanian nurses are very compassionate and take their careers much further than just working an hourly job. I observe nurses going out of their way while not getting paid on their time off to follow up with patients in their homes. The nurses tough through the pouring rain out of the goodness of their heart to deliver a patient's medication in order to ensure the patient has the best chance of recovery possible. Seeing this made me realize the true meaning of nursing and how significant our career can truly be. In our community, the sick and the needy rely on us so much that sometimes even the smallest gestures can create biggest change in someone's life. Nursing in Panama taught me that we should not just do good deeds for ourselves and those in direct contact. We should do them to better the community as a whole, so we may function as a stronger unit.
My perspective on life has totally changed since this trip to Panama. I have realized the things that I completely take for granted, such as being able to drive where I need to go, or having a pair of shoes that fit, are things that should be valued. Growing up in the United States, it is easy to get lost in the material things that we take pride in and find important to us. I personally have never been outside of the country, and this trip has truly humbled me in more ways than one. I can remember watching these kids playing barefoot in front of their house with what little they had, and I could tell that they were as happy as could be. I have always been told that it's the little things that matter, and this trip has allowed me to fully grasp that idea. My perspective on nursing has also changed. I didn't realize how strong a common purpose and profession could be for two completely different groups of people. Working with the students from the University of Panama, we joined together based on our common purpose, which was to provide care to those in the community. Aside from our differences in culture and language, we were able to collaborate together to achieve our goal and provide the best quality of care we could. Nursing was our universal language with the healthcare professionals and students of Panama.
A few of the attitudes necessary to deliver quality care to clients in a new culture are respect, flexibility, being optimistic, and sympathetic. The way I demonstrate that I'm a culturally sensitive nurse is by acknowledging and respecting the different behaviors and norms in a new culture. Once we accept, adapt, and integrate these behaviors, we can be considered a culturally competent nurse. I worked in a health clinic where I obtained vital signs and provided immunizations to both children and adults. I participated in a cancer walk and a health fair. I also did a home visit, which is one of the activities that most affected my global health awareness. Visiting a patient's home provided insight to their living conditions. Safety was one of the concerns I had while visiting my young pregnant patient. Another activity that most affected my global health awareness and practice was teaching first and second grade children the importance of hand hygiene. I had small coloring books made for the children, and it was great to see them start to color and put stickers on them.